So good afternoon, I am Kasirin A. Baracchio, and here I am today to demonstrate the assessment of heart and lungs. But before that, we should always do the procedure, which is hand washing. So make sure that your hands are clean with an alcohol or a proper hand washing. Then after that, you should check the doctor's order regarding the assessment that you are going to do. The third one is you should introduce yourself to the patient. So good afternoon, ma'am. My name is Kasirin Baracchio and I am your student nurse for today. So may I know your name, please?
I am Donalyn A. Karingal,
Your date of birth?
January 19, 2003.
Do you know where you are right now?
Yes po.
Okay, that's good. So, we ask this kind of questions so that we may know if the patient is coherent or in the right state of mind. So, ma'am, what I'm going to do is to assess your heart and lungs, which I will be using a stethoscope and later to check your heartbeat if it is normal and your lung sounds. Is it okay to you, ma'am?
Yes po.
Okay, that's good. So, do you experience any kind of pain before?
No.
Okay. So, are you having a difficulty of before? Okay. Are you having do you have any asthma?
Wala po.
Okay. In your family, is there anyone who suffers from this kind of problems or hypertension?
Yes po.
Okay. How about in your mother's side or father's side? Is there anyone that also having a difficulty in this one?
Father side po.
Okay. So, does your father smoke?
Yes.
How many box or pieces of smoke per day?
3 bucks.
Oh, it's a lot. How about, do you smoke?
No.
Okay, that's good. Okay. So, we ask this kind of questions to the patient so that we may have knowledge about our patient's background and information and also a clinical background. So, for this afternoon, I am going to check your heart and lungs. Are you ready, ma'am?
Yes po.
Okay. So, first thing we must do is to wear your gloves. So now I already worn my gloves. So after wearing our gloves, we must check the chest of the patient and make sure in inspecting the chest of the patient, it is not barrel chested, which is indicative or emphysema or COPD. Ask the permission to the patient if we can remove his gown. So ma'am, since we will start the assessment, can I remove your your gown? Is it okay with you?
Yes po.
Okay. So, babayin natin ng konti. Ayan. So, provide privacy and expose the part that is only to assess. So, which is this one? Ayan. Ito lang yung i-assess natin. So, make sure na may privacy na yung ibang part. So, as we can see and observe, the patient's chest is normal and not barrel-chested. No lesions on the chest of the patient. So, let's proceed to the assessment of the heart. So, in assessing the heart, we are going to use our stethoscope. Okay, let me prepare our stethoscope. Usually, we only hear 2 sounds at the heart of the patient, which is the lub-dub. So, lub is caused by the closure of the mitral and tricuspid atrioventricular valve or AV. Dub is caused by the closure of the aortic valve and pulmonary valve at the end of the ventricular systole. Get the stethoscope to assess the heart and lungs of the patient. First is to use the diaphragm of the stethoscope, which is this one. First is to assess the aortic valve, which is right here of the patient, and that is located at the external border on the right side of the chest. It is found at the second intercostal space, which is this one, as you can see. Ayan. The loudest sound is the duck sound because it is the closing of the aortic valve. Next is the pulmonic valve. This is the second intercostal space on the left external border, which is in here. After in here is the Erb's point. Erb's point is between the pulmonic and the tricuspid, which is right here. After that, move a little lower at the far intercostal space, which will be the loud sound, is the louder because it is opening and the closing of our tricuspid and the mitral valve, which is here.
Mga kapatid, ito po si Captain Bernardo at abangan ang mga exciting na eksena at habang-habang ang kanyang mga bundugod na issue dito sa kapatid natin. Huwag niyo din pong kalimutan mag-scan ng mga digital.
And lastly is the apical pulse, which is found at the midvacuolar line of the fifth intercostal space, which is the point of the maximum impulse. We should check it for at least 1 minute. Okay, after that, we should make sure that there is no wishing sound when we assessed on the 5 points where we placed our diaphragms. After using the diaphragm of the stethoscope, we will now using the bell part by assessing the same location, which is the aortic, pulmonic, Erb's point, tricuspid, and the apical. So this is the bell. So again, let's start.
It's also understandable the plate into loose skin, the short Adamson snap distance. So one of the third for my MPC is the rest of the squat. It doesn't take off anything from all the other attackers, all the other players in Adamson. This one is closest performance for one by MPC. Congratulations to the San Francisco squad who are wearing blue today. Whereas coming up next, it's the Academy of Blue Eagles going up against the NU Lady Bulldogs who still has an unblemished record. That's the big question. Who was able to challenge the Goliaths of this season? And meanwhile, Academy, of course, looks
Yan. After the assessment of the heart, make sure to record the result or the outcome of your heard, and if you heard any abnormal sounds from the heart of the patient. So after that, we will now proceed to the assessment of the lungs. So we're now proceeding to the assessing of the lungs. We are still going to use the diaphragm of the stethoscope and afterwards the bell. In assessing the lungs, we should start above the clavicle, which we can locate at the apex of your lungs. We start from the left side going to the right side and do it in a lateral way so that you can compare both sides of the lungs. So start the apex, which is above the clavicle, left, and write saying inhale and exhale to the patient. So now we will proceed to the apex, which is above the clavicle. So inhale, exhale. Inhale, exhale. Inhale, second intercostal space, inhale, exhale. Inhale, exhale. Third intercostal space, inhale, exhale. Inhale, exhale. Fourth intercostal space, inhale, exhale. Inhale, exhale. Fifth intercostal space, inhale, exhale. Inhale, exhale. Sixth intercostal space, inhale, exhale. Inhale, exhale. And then at the lower lobes, straight body po. Inhale, exhale. Inhale, exhale. After using the diaphragm, use the bell and start again from the first intercostal up to the lower lobes. Inhale, exhale. Inhale, exhale. Second intercostal, inhale, exhale. Inhale, exhale. Third intercostal, inhale, exhale. Inhale, exhale. Fourth intercostal, inhale, exhale. Inhale, exhale. The fifth intercostal, inhale, exhale. Inhale, exhale. Sixth intercostal, inhale, exhale. Inhale, exhale. And the lower lobes, inhale, exhale. Inhale, exhale. Okay, after that, I assess the patient's lungs and I can say that there is no lung problems or any abnormal sounds from the lungs of the patient. So after checking the dorsal part, we should also check the ventral part. Ask the patient to turn around. Ayan. You should always secure the privacy of the patient. And since the lungs is being covered by the scapula, which is this one, we should at ventral part, we will assess the patient's lung along the spinal cord of the patient. And we should ask the patient to bend his shoulders a little. So we can expand the scapula of the patient. So again, start at the apex, going to the mid-axillary part by using the diaphragm, afterwards the bell part of the stethoscope. So ayan. So now we will start with the apex, which is above the clavicle from left to right. So inhale, exhale. Inhale, exhale. Proceed with the second intercostal space. Inhale, exhale. Inhale, exhale. The third intercostal space. Inhale, exhale. Inhale, exhale. The fourth intercostal space. Inhale, exhale. Inhale, exhale. The fifth intercostal space. Inhale. Exhale. Inhale. Exhale. The 6th intercostal space. Inhale. Exhale. Inhale. Exhale. The 7th intercostal space. Inhale. Exhale. Inhale. Exhale. And the midciliary line. Inhale. Exhale. Inhale. Exhale. So now we will proceed again with the bell and start again from apex to midciliary line. Inhale, exhale. 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 Okay, so after that we will tell the patient to wear the gown and assist the patient with that. And after assessing the patient, you must record the findings and the result of the heart and lung of the patient, and you should report it to the physician. So disinfect the stethoscope, discard the gloves, and do the hand washing procedure.